Hey guys, welcome back to Broken Journey, the podcast. I am your host, Elba Rivera. I wanted to say thank you so much for joining me today. I hope that you're having a good morning, a good afternoon, or a good evening. Whenever it is that you're listening to this podcast, I hope your day is going well. I also hope that today you enjoy today's podcast episode. And if you do, please share it with others. I will greatly appreciate it. I hope you have a good day. Bye. Hey guys, today is going to be part 1 of a 2-part series of mental health awareness. So the month of May is Mental Health Awareness Month. And I was talking to several friends who have been battling depression. And one of my friends, her son is actually battling depression as well as we speak. And it's so heartbreaking, right? To really see somebody go through that situation. And so a friend of mine mentioned that I should talk about it on my podcast. So thank you so much. You know who you are. And I thought I'd get that information out there because a lot of the times we really don't realize when a friend is battling depression or a family member is battling depression because they're hiding it, right? Or because of a chemical imbalance that, all of a sudden you see that this person is acting up or, they're lashing out or things like that. And you're like, what the hell just happened? Right? So again, this is a part 1 of a 2-part series. And I just want to put this information out there. It's really good to know in case you see something happening in your family and you would like to find out how to get help, right? Because sometimes it's very hard to figure out where to go to get help. And hopefully these 2 episodes will help you with that. So, first, I want to describe what mental health conditions or illness is, right? So, a mental illness is a condition that affects a person's thinking, feeling, or mood. These conditions deeply impact day-to-day living and may also affect the ability to relate to others. Mental health conditions are far more common than you think, mainly because people don't like to or scared to talk about them. Again, that's what I'm just finished saying. A lot of people don't want to talk about it, feeling like they're going to be judged by you because they're battling, depression or some other things that are part of a mental health condition, right? And it's funny because before I give you a list of the mental health conditions, I didn't realize that some of these things were considered a mental health condition. And so before I go with the list, I'm going to give you some statistics, right? 1 in 5 U.S. adults experience mental illness each year. 1 in 20 U.S. adults experience serious mental illness each year. 1 in 6 U.S. youth ages 6 through 17 experience a mental health disorder each year. 50 of all lifetime mental illnesses begin by age 14 and 75% by age 24. When you look at the teenagers, they go through so many different hormonal changes and things like that. So you kind of think of it like, you brush it off, they feel like they're the only ones going through things and stuff like that. Or nowadays, and I'm going to age myself here, but back in the day when I was younger and, we would get bullied and stuff like that, we would either fight and get it over with, or, figure something out, right? Nowadays, I think kids are a little more sensitive, and I'm not discarding, their feelings. However, I think, it's harder for them to deal with, bullying and things like that. And kids are so harsh. Let me tell you, that's another situation, probably for another episode. But, sometimes we need to talk to our kids about other people's feelings so that they are not dismissed, right? And so I want to give you a list of the mental health conditions, and I will be talking only about 4 of the health conditions, and I'll tell you those 4 after I give you this list. So, anxiety disorders, attention deficit hyperactivity disorder, also known as ADHD, bipolar disorder, borderline personality disorder, depression, dissociative disorder, eating disorder, obsessive compulsive disorder, also known as OCD, post-traumatic stress disorder, PTSD, it's also known as PTSD, psychosis, schizoaffective disorder, and schizophrenia. So, for me, when I thought about mental health conditions, I was thinking, the PTSD, the schizophrenia, the depression, bipolar disorder. But I didn't realize all the other ones. And it's very interesting because my friend gave me the website for the National Alliance on Mental Illness. And there is where I was able to find the information that I needed for the podcast, right? And when you start looking at all these conditions, you don't realize that there might be people that have those symptoms, and you kind of dismiss it, right? A lot of the times, we just think, oh, whatever, it is what it is, or they're acting up because they want attention. And however, some people are not, and you don't realize that that person really has a condition, and maybe they're not taking the medication that they need to take. For certain conditions you need medication, and for some conditions you don't. Some conditions you're able to try and work through it. Again, maybe not. When I looked at these treatments, when I looked at, if there's treatments or whatever the case may be, they say that, people should take medication for it. I guess for me, I'm a little anti-medication, and I feel like, there's in some conditions, there's alternative methods that you can do, and it's not for everyone, right? Not every condition could be without their medication, right? Like, for instance, the bipolar disorder. I know someone who has that, and they need to be on their medication, because if they're not, then they start acting up. They start, causing a scene with their family and things like that. And, it's very hard to see, that person go through that. But it is what it is, right? And hopefully, they can keep themselves together with the medication and things like that. So, what I am going to talk about in these episodes, so part 1 is going to be about ADHD and depression. And then part 2 is going to be anxiety disorder and eating disorder, right? So I'm going to start with ADHD, which is attention deficit hyperactivity disorder. So Attention deficit hyperactivity disorder, also known as ADHD, is a condition in which characteristics by inattentive, hyperactivity, and impulsivity. ADHD is most commonly diagnosed in young people. An estimated 8.8% of children ages 4 through 17 have ADHD. While ADHD is usually diagnosed in childhood, it does not only affect children. An estimated 4.4% of adults ages 18 to 44 have ADHD. And a lot of times people don't realize it, and they go about their life struggling with paying attention or focusing or their ability to do work, because, when you work for a company, you need to focus on certain things, projects, spreadsheets and things like that. And sometimes it can be difficult. Sometimes I say I have ADHD, and I probably shouldn't, because, you put that into the universe and you start manifesting those things. So from now on, I'm going to say that I do not have that. And I've never been diagnosed with it, right? But sometimes I have a difficult time focusing. And I think it's because I get bored often, which sometimes can lead to me thinking I may have ADD, which is attention deficit disorder, right? However, I've never been diagnosed. So again, I need to stop putting that into the universe and stop talking about it as if I have it. However, my niece and my nephew have ADHD. And, I've seen them grow up with it and the struggles that they've had with it as well. Okay, so here are signs of intentiveness, right? Becoming easily distracted and jumping from activity to activity. Becoming bored with tasks quickly. Didn't I just say that? Difficulty focusing, attention, or completing a single task or activities. So I do complete tasks, so I should be okay. But I do have an issue focusing sometimes. Trouble completing or turning in homework assignments. Losing things such as school supplies or toys. Not listening or paying attention when spoken to. Daydreaming or wandering with a lack of motivation. Difficulty processing information quickly, struggling to follow directions. Those are some of the inattentiveness, right? And then there's a portion where it's the hyperactivity. So here are signs of hyperactivity: fidgeting and squirming, having trouble sitting still, nonstop talking, touching and playing with everything, difficulties doing quiet tasks or quiet activities. They seem to want to make a lot of noise and things like that. So those are some of the hyperactivities. And then here are signs of impulsiveness: being impatient. Not, if you tell the person, wait a minute, give me a minute, let me do this, and they keep asking even though you tell them you want them to wait a minute, right? Acting without regards of consequences, blurting things out, difficulty taking turns, waiting, or sharing with people, right? And then the final one for the impulsiveness is interrupting others. So when the person interrupts or the child interrupts and you tell them, you need to wait. I'm in the middle of a conversation. When I'm done, I will, talk to you or whatever. And they continue to interrupt you and continue to interrupt you. That is, another sign. So you want to pay attention to those signs as the kids start, when they're a kid, right? And then if you are an adult and you were never diagnosed as a child, these are some of the symptoms that you want to kind of look into and see, if this is something that you are experiencing, and you might want to go and get with a doctor or your primary care doctor, right? And see if they can evaluate you. And so there's also causes, right? A lot of it is genetics or environmental factors, right? So some of the environmental factors are considered women smoking or drinking alcohol while pregnant. And then we have treatments. And I will say that my son was having an issue when it came to school, when we moved from New York to Florida. And I will tell you that story after I read the treatment, right? Because for me, I was having an issue with these treatments. So, treatments that people can take or give to their children is medication, including stimulants, non-stimulants, and antidepressants, behavior therapy, self-management, education programs, and assistance through school, work, or alternative treatment approaches. So, my son was not diagnosed with ADHD. However, he was having an issue focusing in, I think it was the 4th grade when we first moved out here. I think he was in the 4th grade or so. And I went to a parent-teacher conference, and the teacher was talking to me, and she was telling me, your son is having an issue with focusing. He's not paying attention. His attention span is very short, la, 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 la. And I said, okay. And she says, now, before I say what she said, teachers do have the education to see these symptoms because they're educated on it. However, I feel like the way this teacher approached me regarding my son was not the right way to approach a parent, especially Mama Bear over here. I was very protective over my children, right? Anyway, so back to the story. My son's teacher told me, I believe your son has ADHD, and these are the symptoms. I said, okay. And she says, you need to put your son on medication if he's going to be in my class. And you need to have him there so that he can have them with the medication so that he can focus. And my reaction wasn't also nice. First of all, ADHD, I really didn't know too much about it. This teacher is just telling me, this is what the symptoms are. I think this is what your son has. She was diagnosing him already, putting him with the medication and everything. And so I told her, listen, I said, I will, look into it, and I will speak to my son's doctor, and I will not be putting him on medication. And she was like, well, if you want your son to progress, you need to put him on medication so that he can progress in class. Girl, guy, whoever's listening. I was just like, no, this bitch didn't. And I'm sorry to all the teachers out there, but reality was, I was not trying to hear that. You do not tell me what I need to do. So that's exactly what I told her. I was like, listen, I said, you do me a favor. You stick to teaching, and I will stick to parenting. You don't tell me what I need to do with my son, and I won't tell you what you need to do with my son while he's in your class. I said, now, if you have an issue with teaching my son because you feel like he has ADHD, then let me know, and I will go down to the principal's office and I will have them change his class immediately. And she didn't know how to react. Now, mind you, I'm a native New Yorker, and my attitude was all over the place. I was like, she is not gonna tell me what to do as a parent. Now, mind you, again, I was a little bit uneducated about the ADHD, but still, I was not trying to hear that. I was like, put my son on medication. I was like, first of all, you don't even know my fucking family background. Okay? My family background, we have people who have addiction to drugs. So I'm not putting my son on no fucking drugs. Are you kidding me? Anyway, so that was a situation. I went to the principal and I said, I would like my son to be evaluated for ADHD. And so here in Florida, in the state of Florida, you can have your children evaluated. Now, this was back in the day. Now, my son is 20, he's going to be 27. So back then, you were able to get your children evaluated through the school system to check on them. And I also did my part, right? Where I asked his primary care provider to recommend him to a neurologist. And when I took him to the neurologist said he did not have ADHD. However, he did have a similar situation, which is, I guess, a similar diagnosis, right? Not situation. A similar diagnosis of a focusing issue, which can be like a sister or a brother to the ADHD and the ADD. And so I said, okay. And he said, your son does not need medication for this. What you have to do is help him train his brain to focus a little bit more. So little by little, you need to do some exercises for him. And every time we would go visit the doctor, when we would leave, the doctor would give him a word to remember. So when he went back, now mind you, I forgot what the word was, but my son remembered that. He will always remember what the doctor told him. And so he says he doesn't need any medication. He is fine. Just help him do exercises to help him remember, right? And that's what we did. And don't get me wrong, it was hard. It was hard, especially as a single parent, going to work, coming home from work, helping my son with his schooling, because my daughter, who is the older one, I would tell her, Angie, you got to do your homework. She would go and get her work done. And I would tell my son, and he was hours and hours. It was like 9, 10 o'clock. And I'm like, I'm freaking exhausted. And we're still here sitting on the damn table. And I would get angry at myself because sometimes I would lose my patience, right? I would lose my patience because I was like, why can't you get it? Why can't you get it? And obviously me not understanding, because I didn't have that issue, it was a little hard for me to deal with it with my son. Did I get angry a lot of times? Yes. Did I scream at him a lot of times? Yes. Did I get frustrated? Yes. However, I still worked with my son to help him through that process. And eventually he started to practice a little more and try to help himself a little bit more. And he would get really anxious about taking exams because he thought, I'm on a time frame. And when, and I think everybody goes through this, there's a timer and you're focusing so much on the timer that you're not focusing on what you need to do. So there is a program called the 504 plan. I believe that's what it's called. It's the 504 plan. And that plan gives students with focusing issues, ADHD, ADD, gives them additional time to take their exams. And so when, let's say the teacher gives them 20 minutes, if this person has ADHD, ADD, or a focusing issue, they will put them outside in in the outside of the classroom and give them an additional 10 more minutes or 15 more minutes. Or they will put them in a different classroom altogether and give them, instead of 20 minutes, they'll get 30 or 35 minutes, right? So look into it if you are either in the Florida area or anywhere that you are at. Look into it, because there are programs out there for kids with ADHD and so many people do not know about it. So do your research and look into it, right? And so for me, I chose to give my son some natural medications that I got at a Whole Food store, and they were veggie waffles. They were chewable, not waffles, wafers, sorry. They were chewable wafers, and they had vegetables, they had all different kinds of veggies, fruits that would help them to stay focused. Now, another thing that you need to consider with children who have ADHD is their diet. Their diet is very, very important to their focusing, right? Sweets and dairy are very bad for people who have ADHD. So you want to eliminate as much as you can of those two things, right? And there's other things too that you can eliminate to help them with their focusing. And if you can't eliminate it altogether, maybe eliminate it while they're in school, like right before school. Don't give them, certain dairy like cheeses and yogurt and sweets like juice, or like waffles that have syrup in it, things like that, things that have like a lot of sweets. You don't want to give them that before they go to school, right? So guys, that is ADHD and my experience that I had with my son and the teacher and things like that. So now we're gonna go into depression, and I am going to give you a description of depression, right? Depressive disorder, frequently referred to simply as depression, is more than just feeling sad or going through a rough patch. Again, like I said, we go through rough patches and things like that with a breakup, or you're not feeling yourself, you've gained weight, you've lost weight, or, you feel like you're alone and things like that. Those are light patches, right? Or rough patches, rather. It's a serious mental health condition that requires understanding and medical care. Left untreated, depression can be devastating for those who have it and their families. Fortunately, with early detection, diagnosis, and a treatment plan consisting of medication, psychotherapy, and healthy lifestyle choices, many people can and do get better. About 21 million U.S. adults, 8.4% of the population, had at least one major depressive episode in 2020. People of all ages and all races, ethnic and socioeconomic backgrounds experience depression, but it does affect so many more than others. So, depression doesn't care if you have money, if you don't have money, who you are, what your status is. Depression will hit anybody. And again, I have a friend who just left her job and said, you know what? My son is more important than this job. I can find a job anywhere, but I cannot find another one of my sons, right? And that was a bold move, and I am so happy that she was able to do that. And I continue to pray for her and her son and her family, her husband, her other son. Because it's not easy. It's not easy dealing with someone who has a really severe depression episode, right? And it's not an episode. I'm not going to say episode, who really is dealing with depression, plain and simple. An episode is probably like the little rough patch, like when you have a separation, or you're feeling overweight and you haven't lost the weight that you wanted and you're feeling depressed because of that. This one is far more serious than just a rough patch, right? So I'm going to give you some symptoms of depression, and these are just some symptoms that were on the website. Some people experience different symptoms and you don't realize that it's part of a depression, right? But however, most people and research show that a lot of these symptoms are part of depression. So, symptoms of depression. Depression can present different symptoms depending on the person. But for most people, depressive disorder changes how they function day to day, and typically for more than 2 weeks. Common symptoms include changes in sleep, change in appetite, lack of concentration, loss of energy, lack of interest in activity, hopelessness or guilty thoughts, change in movement, less activity or agitation, physical aches and pains, and suicidal thoughts. So, I know that a friend of mine had a cousin who was in the military, and he had severe symptoms of depression, and it could have been PTSD as well. And one day he decided to take his life. Sometimes, and I'm going to speak for what I know in the Latino culture, a lot of the times when you are in the Latino culture, they tell you, oh, suck it up. And this is something that, they probably say in Spanish, like, esos son bobería, esos son mierda. Ellos lo que quieren es atención. Ellos esto, ellos lo otro. And for those of you who don't speak Spanish, I will try to translate it in English, but it's very hard. Basically, it's telling you to suck it up. You really don't have any problems. You're just acting up. You just want attention and things like that. And reality is, a lot of the Latino men don't talk about it because they feel like it's a weakness, right? They feel that they're going to be considered a weak person because they're battling depression. And some of the times, these are things that you can't control, right? When you go through traumatic experiences in life, these things happen, right? So let me just give you some of the causes that I saw on this website. And so it says causes. Depression does not have one single cause. It can be triggered by a life crisis, physical illness, or something else. But it can also occur spontaneously. Scientists believe several factors can contribute to depression. So, here are some of the factors. Trauma. When people experience trauma at an early age, it can cause long-term changes in how their brain responds to fear and stress. These changes may lead to depression. Another cause can be genetics. Mood disorders, such as depression, tend to run in families, right? And if it runs in the family, it's very hard to not battle that when there's several people dealing with it, right? Life circumstances, marital status, relationship changes, financial standings, and where a person lives influences whether a person develops depression. Brain changes. Imaging studies have shown that the frontal lobe of the brain becomes less active when a person is depressed. People who have a history of sleep disturbances, medical illness, chronic pain, anxiety, and attention deficit hyperactivity disorder are more likely to develop depression. Some medical symptoms, like hypothyroidism, can mimic depression disorder. Drug and alcohol misuse. Adults with substance use disorder are at significant high risk of experiencing a major depressive episode. Co-occurring disorders require coordinated treatments for both conditions, as alcohol can worsen depressive symptoms. So, diagnosis, right? How do people diagnose these conditions? To be diagnosed with depressive disorder, a person must have experienced a depressive episode lasting longer than 2 weeks. The symptoms of a depressive episode include loss of interest or loss of pleasure in all activities, change in appetite or weight, sleep disturbances, feeling agitated or feeling slowed down, fatigue, feeling of low self, guilt or shortcomings, difficulty concentrating or making decisions, suicidal thoughts or treatments. So, before I go into some of the treatments that they recommend, I am going to suggest that if you are feeling suicidal or have intents of suicide, please contact the National Suicide Prevention Lifeline. It's 1-800-273-TALK. 1-800-273-TALK. TALK. Or you can dial 1-800-273-8255 for assistance when it comes to suicide, right? Alternative approaches include acupuncture, meditation, faith, and nutrition can be part of a comprehensive treatment plan. So guys, here are some information that you can use, or symptoms that you see with other people in your life that you may see kind of steering away from the family, or seeing that they're not being as productive as they used to be. So let me just say that sometimes the conditions about being lack of interest and things like that, sometimes that's not the case. Like, for instance, Chesley Chris, she was Miss USA 2019. She was a high functioning depressed person. And what that means is basically the person is fine. They seem like they're fine, right? They're going and doing everything productive. They're always happy. They're always joyful. And, you don't realize until, the person commits suicide that you're like, what the hell just happened to them? Look at, what's his name? I forgot his name. He is Robin Williams. I thought about Miss Doubtfire, and that's how I remembered his name. Robin Williams. Who would have thought that he would kill himself? He was such a fun actor, and always made people laugh and things like that. So you never know, you know, how people will react to certain things and who is hiding the depression, right? So look after your friends and check up on them and check to see how they're doing. And, you know, if you see that there is a friend who is going through a situation, just listen to them. Sometimes people who are battling depression or are having a rough patch, sometimes they just don't want to hear advice, right? Sometimes they just want to let out their feelings and talk about it. And that is a good way to deal with therapy. And sometimes people don't want to go to therapists because they feel like, the therapist is not going to help them. They don't know what that person is going through and things like that. And it may or may not be. I know I've been through therapy several times. Sometimes it's just good to talk about what you're feeling, what's the symptoms that you're feeling and things like that. And if you feel like you're alone, again, you can always contact the National Suicide Hotline. You can, nowadays, they have Zoom therapy, right? That you can actually go and do therapy from your house, and you don't have to do therapy in an office or going somewhere where you don't want someone to see you. You can do it on your phone or something like that, So anyway, guys, this is part one of the two-part series of Mental Health Awareness Month. I hope that this information has really given you an insight, has given you information that you need to help you with or help you see these things in a family member or in yourself. Sometimes we don't realize that we're really going through a depression unless, we know the real symptoms behind it, right? So guys, if you enjoyed this message, please share it with your friends. It would mean so much to me. And I pray that you guys will get the help that you need if in fact you are feeling depressed. See you in part 2. Bye.